on your health tonight, new hope for new moms as the FDA approves the first pill to treat postpartum depression. Here to answer your questions is Dr. Erica Lee, a psychologist at Boston Children's Hospital, to talk more about this. Good to see you, Dr. Lee.
Hey, Dr. Lee. It's always great to see you. So let's talk first about postpartum depression. How common is it? You know, if 100% is everyone that gives birth, how common is it?
I'm so glad you're talking about this. So thank you for spotlighting a very important topic that really is not discussed enough. The estimates show that about 1 in 7 women develop postpartum depression. So this is a problem that impacts a lot more mothers than people often think. And it's important to know, right? Most moms experience what we call sort of the baby blues, right? Some sadness in the first few days after a baby is born that typically resolves and doesn't impact their ability to care for their child. But with postpartum depression, or PPD, it lasts at least 2 weeks. It can develop anytime within the first year after a baby is born. And it often includes these overwhelming feelings of guilt, sadness, or panic, and even hopelessness or thoughts of suicide. So this is really important to talk about.
Oh, yeah.
Yeah, absolutely. There was a recent survey about who's most at risk of developing postpartum depression. So it found that the risk is highest among first-time moms, moms younger than 25 years old, and mothers of twins. So what can you tell us about the impact of their illness on their children, or babies, or any of their aged children at home?
Yeah, great question. So because moms who experience PPD are at higher risk themselves, right, for developing major depression and also other psychiatric disorders, of course, this absolutely impacts their children and their families. So what we know is that moms who have PPD, they may have difficulty bonding with their baby. Maybe they're having trouble responding to their baby's needs. They can't take care of themselves, or a partner or their family. They might have difficulty partnering and parenting in like a non-harsh way. And also often this leads to relationship problems with their partner as well. And research shows over the long term that having PPD is linked to having a child with lower IQ, slower language development, more behavior problems, and also a higher chance of developing depression themselves.
Oh, that's interesting. So, Dr. Lee, we know that new moms need support. That's without question, whether they develop PPD or not. But if a woman is clearly struggling, how can friends and family help?
Right. So PPD is something that often goes undiagnosed, untreated, untalked about. We do need, as you're saying, to support mothers through all phases of pregnancy and in this critical postpartum period, right? They're under so much stress, pressure, sleep deprivation. What we want to do is we want to normalize checking in with moms. How are you feeling? How are you doing? And if there are any warning signs of depression or postpartum depression, we have to take those seriously. So if you have a friend or a family member who's crying and worrying a lot, they're feeling guilty, like they're not good enough mom, they can't take care of themselves or their baby, and of course, if they're having thoughts of hurting themselves or their child, this is when you want to say, hey, should we talk to a doctor? How do we get you more support? Because the earlier you intervene, the better the mom and the child are going to do.
Right.
Dr. Lee, we thank you so much for your insight on this important topic, as always.
Great to see you, Dr.
Thank
Lee.
you.
Take care.